There he is.
Yeah.
How you doing?
I'm good, man. How you doing?
Good. It's been a minute. I feel like probably not, but I feel like we haven't talked in a while.
We kind of talked last night.
Oh yeah, that's true. That counts.
But it's been a while. You're right.
It counts.
To try to figure out what we're going to talk about today.
When are we gonna get you on the podcast talking about your book? When is your book out?
It's on Amazon. You can pre-order it.
I did that.
I think the release date. I'll tell you. That's a good question.
Because we should. I mean, we can record one and then bank it, but we should definitely have one ready.
We can talk about it anytime, for sure. Hold on.
Well, I have to read it first.
Well, I'll get you a copy. I have copies. Okay. I'll get you a copy.
Okay. I ordered it anyway. Oh, Rachel's. Should I let her in?
Yeah. Later on, she can be part of this conversation.
Perfect. I'm letting her in. Oh, her camera's off.
It is for the moment.
Oh, that's okay. Hi, Rachel.
She's doing her.
I like the picture.
Thanks.
Nice picture.
Gotta wait until she's done with her makeup.
You got it.
Hair and makeup.
Oh, September 7th.
Didn't know if I was going to use my green screen or not. I like the blur feature.
We'll be the judge of that. Yeah, that's cool.
But
wait, are you on now? You're not on. Right?
No.
What's the blur?
What's
that? What's the blur feature?
Well, it looks like this, except because my hair.
Yeah.
You see the green, but on the blur without the green screen. This is what my background is.
Right.
Like this is the room.
I can only see the green. I can see the green between your fingers.
Yeah,
exactly. So
the green screen
without the blur. I mean, with the blur, without the green screen, you can't see my hair at all. It looks like.
Oh, right.
Oh no, I think it looks fine the way it is now. You can't. The only thing you can see.
Yeah.
Yeah. Don't do this. Just go like.
I'm an adult now, and I was exposed to, and so who knows? It could have been that way the whole time. I know Portland's always been crunchy granola. I will tell you though, Portland, Maine is crunchier.
Yeah,
I have been there, and I'm
really?
Like, Portland, Oregon has nothing on them.
Yeah,
right, so I'll give you my. I think it was the first time it was a conference I went to. So Eric and I, my business partner Eric, we get a hotel room. So we go to this hotel room. It's attached. There's a restaurant and I think a lounge that's all made like a log cabin, and they have a Sasquatch there. You go in the room, and it's a big mural of Spider-Man from floor to ceiling, all the way up. And on your nightstand, you have condoms available for you. That's how you're greeted in the
hotel. Really?
Is that the Doug Fir Lounge?
Yeah, exactly.
Yeah.
Doug Fir Lounge. That's exactly the place. It was the coolest place ever, man. It was just so odd. And they have a player piano there, just like random stuff. So yeah, that's Portland.
I'm going. Well, now I have to go. So Len, do you want to give Rachel the sort of lowdown on how this all works?
Yeah, I think we kind of talked about it, but we're going to go and talk free form and all that stuff. Then I have like 3 questions that I ask all the guests. Then after those, you can say where people can find you or whatever, and then you're free to exit and leave. And then John and I will continue talking nonsense.
Yeah, we're going to talk, and we don't. We just talk about our guests behind their backs, right?
We'll find out eventually.
Exactly.
All right. So I am rolling. So Len, you let me know when you want to do your thing here.
Anytime.
All right, let's do it. All right, 3, 2, 1.
Ladies and gentlemen, boys and girls, welcome to another episode of Everything is Personal. And as always, I love that. My wonderful co-host, the super vinyl, John Small.
Thank you, Len, and it is wonderful to be here with my soundboard. I really actually have to update my sounds because I think our audience is getting a little bit sick of my sounds. But
I like the.
Thank you for having me today, and I'm very excited about our guest.
Super excited.
Portland's own.
All right, so let me give an intro, but I'm not going to do it justice. So, you can then follow up, but I'm super excited. We're super excited to have Dr. Rachel Knox with us. So let me see if I can describe, I'll read a little bit of what I wrote, but then I'll try to give my own description. So Dr. Rachel Knox, MD, MBA, cannabinoid medicine specialist, and clinical endocannabinologist. So the first question I have, welcome to the show, Rachel. Before I even start
Rachel.
questions and all that stuff, I gotta ask this question because I love this word. Where did endocannabinology come from?
Well, in conventional medicine, we like to name specialties and areas of study after, body functions, organs, and systems. So you're familiar with cardiology, right? And neurology and endocrinology, and all those things mean is that you're specialized or you're studying in that organ system. Right. Cardiologist specializes in the function and dysfunction and treatment of the heart and the circulatory system, right? And a neurologist, the brain. Well, we focus on the endogenous cannabinoid system. It's function, dysfunction, and modulation using things like cannabis, our bread and butter. So we call ourselves endocannabinologists. We practice endocannabinology. Cannabis being the most versatile tool that works on this system. By default, we become cannabinoid medicine specialists. And I remember the first day I used the term endocannabinologist, and it was at a conference, I think back in 2018, and it was an MJ for MDs conference in Colorado. Mm-hmm. And I looked out into this audience of health and medical professionals, and I said, "You all are endocannabinologists," and you can hear the pin drop.
What?
Right. I've been called a lot of things.
Yes, yeah. I know, but I was trying to explain, we cannot reduce ourselves to cannabis specialists. We're doctors and nurses and, care providers of humans,
right? Of
human beings and their bodies. And we don't grow cannabis inside of us. So why are we calling ourselves pot docs or even cannabis doctors? Mm-hmm. We're doctors of humans. We're doctors of the endocannabinoid system. So that makes us endocannabinologists.
So do you have to be a healthcare professional, or can anybody that works within the cannabis space and trying to use the plant, the phytocannabinoids to help heal people, can we call ourselves endocannabinologists as well?
The term implies that you study, right? You study this system. Mm-hmm. Traditionally, and really I should say conventionally speaking, we're talking about people who are licensed or certified in, with a background in pharmacology and physiology and, care for dis-ease. That being said, I consider massage therapists and doulas healthcare providers as much as I understand that a neurologist is a healthcare provider.
Right.
So I think especially when we're talking about cannabis, we need to acknowledge that there are a lot of types of experts that care for people with plant medicines. I would throw shamans in there, right? And so, endocannabinology, just to be succinct about it, just means somebody who studies this and has a command over the application of cannabis in particular, right, amongst other things, to address dysfunction within the endocannabinoid system.
Well, I definitely study it. I'm not sure how I address it. So maybe I'll borrow that term every once in a while and use it and throw it out there. So Rachel, who are the Knox docs?
The Knox docs are my family. Minus my bro. I guess I try to throw him a bone every now and then. He is a doctor of jurisprudence. So,
Okay.
We could consider him a Knox doc, but no. So the Knox docs are my parents, Dr. David and Dr. Janice Knox, and my baby sister. I'm the middle child.
Right. I couldn't tell.
For all you middle children out there, got you. Dr. Jessica, my baby sister, and we are all conventionally trained. My parents in emergency medicine and anesthesiology, respectively. my background is in family and integrative medicine, and my sister in preventative medicine. And it was 2016 that when we like formally banded together under the Doctors Knox brand, if you will,
Right.
When we founded our American Cannabinoid clinics, because we felt that the typical pot doc cannabis card clinic model was insufficient for newcomers to cannabis as medicine. Don't get me wrong. When I first got into this space, I had patients educating me. I learned a lot from legacy medical patients.
Right.
But now that University of Google is teaching all of us that cannabis is medicine, there are a lot of people turning to it for medical use and just did not know where to start. And we felt that it was our job as licensed medical doctors to be a resource to these patients. We've studied pharmacology. We've studied physiology. It is us who should be here to help patients figure out how to use cannabis as medicine. So we decided to step up and be that kind of resource.
Is part of that also educating other healthcare professionals?
You got it. 100%. I mean, we're part of the root problem, and we need to be part of the root solution.
Right.
To normalizing, put in air quotes, normalizing cannabis use.
Is there any pushback from healthcare professionals on what you're doing and the legitimacy of the endocannabinology, or like other healthcare professionals, doctors saying, yeah, this is not traditional medicine, we don't believe in this stuff, do we even have an endocannabinoid system, that kind of stuff? Or
well, first I like to tell them that it is traditional medicine. Traditional medicine is the oldest medicine. Strangely, we call conventional Western medicine traditional. I think that's unfortunate that we spellcast like that, if you will. Alternative is what we consider, traditional Chinese medicine, Ayurveda, which is crazy because that's a portmanteau between alter and natural, native, right? Yep. Alter, like what's actually counter to nature, our conventional way. So I like to make that correction first, and acknowledge that traditional medicine is natural and holistic medicine. It's our ancient medicine. So my conventional Western colleagues, I think, are surprisingly understanding when we lead with the science, when we lead with the physiology of the endocannabinoid system, and use cannabis as an example of just one of many tools that works on this system.
Right.
Explaining that cannabis is a plant, not a drug, but it's full of drugs. It's full of substances that are pharmacologically active, and very similar to us prescribing individual drugs that might make up a drug cocktail that many patients are taking, like 20, 30 drugs a day. Oh my God. Yeah. Applying the pharmacology of cannabis is no different. And when we frame conversations that way, there's no pushback. But there are still instances where licensing boards are, bearing down on medical professionals who are authorizing the use of cannabis.
Right.
Still a lot of stigma. I think we still have some mountains to climb.
Yeah, it's interesting that you said the drug cocktail. So I was in a group of part of this men's group, and everybody was like, "What's your biggest fear?" And everybody went around with their fears, and most people were saying the fear of dying and all that stuff. And I said, for me, it's fear of being incapacitated and not being able to take care of myself. And I said, my vision from this started with my grandfather. So my grandfather ended up having like 7 strokes and 5 heart attacks. He was part paralyzed, but I'll never forget. I have this image in my head where he pulls out a little shopping bag, and there's at least 30 different bottles of different pills that he was taking. And some of them are to address the side effects from the other pills that he was taking. So he kept on piling on. He wasn't getting any better, but he was just constantly taking more and more pills. So that's the image I always had in my head. And that's why, I personally don't take any, whatever you call pills or prescription medication or even over the counter stuff. I believe in herbal remedies and plant medicine and all that stuff. Not that I'm advocating it. I'm sure it works for other people for certain things, but this fear of having this system that we have in place, that is a system that's a for-profit system that says, well, it's not in our best interest to cure anything. It's in our best interest to get you on something. And if something else breaks from that, we'll give you something else. At the least, we keep making money off you. So why not? So I would just think that a lot of traditional medical practitioners and pharma, they look at this and saying, this is a threat. So what can we do to attack on this threat and use, our resources to say, this is not real. This is bullshit. It's not, cannabis is a drug and all that stuff. And it perpetuates that stigma. So I think it's sort of moving in a much better direction for us as an industry now that we're seeing, like, West Virginia. Who would ever thought, man? When Texas happens, that's going to be it. I think that's drop the mic moment. But I just want to hear your thoughts on that, if what you feel about what I just was talking about.
Yeah, I find the argument, the age-old argument, that pharmaceutical drug, prescription and their role in medical management is supported by evidence, right? It's evidence-based care. Right. And I have to remind folks, there's not a single study out there that demonstrates the safety of any of these medication cocktails. Mm-hmm. Individually, sure.
Right.
But none of them have been studied in concert with one another. And so, for whatever reason, medical professionals are comfortable managing these laundry lists of prescription drugs that come with them a host of side effects and, cause adverse effects that then we prescribe more drugs to treat.
Right.
And we're okay with that? Like, somewhere deep down inside, I hope the majority of us were cringing as we prescribe the next drug.
Yeah.
And I do think that's problematic. Again, we have no evidence to support that is safe, or that we should be doing that for chronic care management. Right. Most drugs have only been studied for, a finite period of time. And so we can say, yeah, it seems like this product is safe for general consumption, but for how long? Right? None of these drugs were designed for chronic, lifelong use.
For sure.
And then, 10, 20 years later, something goes wrong. We have data and we're recalling things left and right when it's too late. It's already had a negative impact on so many people's lives. Where, on the other hand, cannabis and other plant medicines have a long history of being quite benign, quite benign. And we know that there have been no deaths directly attributed to cannabis use.
Right.
Not only that, we have research that tells us how certain cannabinoids behave in the body to address myriad conditions, right? Myriad disease states. And I think that is sufficient for us to completely change the paradigm here. Unfortunately, there are competing interests.
Yep.
And whose interests I'm talking about.
Yes.
Because chronic disease is a commodity.
Right. Absolutely.
That's what it is, right?
Mm-hmm.
Keeping people sick is profitable.
Yep.
And the only ones who can change this are us.
Yep.
And no wonder cannabis legalization has been quite patient driven.
Yes.
Right. I think people are tired. People are fed up.
100%. So on everything is personal, I want to get a little personal. I don't know if people were asked you these kind of questions before, but I want to start with your childhood. Like, where did you grow up? And maybe you can talk a little bit about your childhood. I'm curious.
Okay. Well, I grew up in Oregon. Mm-hmm. See, I was born in Portland. I lived in Beaverton until I was about 2, and my parents moved my brother and I to West Lynn, which is a suburb in the greater Portland metropolitan area. Mm-hmm. Went to Portland private schools, and then went to Duke. And nobody in my family likes Duke. So I still get a hard time.
Why is that?
Fans? or
Is it
something?
basketball or something?
Yeah, my family's until me and then my sister were all Pac-10 at the time.
Oh, I get
My
it.
brother and mom are both Cal Bears.
Right.
My dad's a double Husky, although he's from Eastern Washington. Yeah, so I ventured out east to Duke, and I majored accidentally. I say accidentally because I didn't intend to major in African American studies, but I did. And this actually does, I don't know if we're going to get there, but this plays into where I find myself in the cannabis industry today. But I took one very popular intro to African American studies classes. And this is what like all the Black students did. But I took it and I was like, are you kidding me? That's my history? Like as an 18-year-old taking this course and realizing this was the first time I got any glimpse to the real history of Black people in America, I was floored. And I ended up taking class after class after class, and I was pre-med. I intended to major in psychology, and that did not happen. And very, very ironically, when I had finished my pre-medical studies, ultimately, I told my mom, I'm not going to go into medicine. I'm not going to apply to medical school. I think I'm going to pursue a PhD in African American studies because I'm going to start African American school. Just thinking that other cultures who have come into our country and maintain their identities have Chinese American school or Hebrew, American school or German American school, and they maintain their language and their heritage, and they pass on stories. And that was something that I felt Black people in America have been deprived of. Right. And I was like, this is going to be a root solution to creating a core and shared identity and solidarity in the Black community, and we're gonna make it. My mom was like, girl, you and your sister, listen, I was hoping you weren't gonna go into medicine because it's changed. Right? That was her first point. But second point was you put in all this work and you're more than capable of doing medicine differently.
Right.
So Jess and I applied only to MD, MBA, dual degree schools. We both got into Tufts in Boston, and so there we went. It was also the only school that offered both degrees in 4 years, and we were like, we're not spending not a year longer in school. But it was during those 4 years and during my studies in healthcare administration that I realized that medicine was big business, and that we doctors weren't learning the business of our own profession and for particular reasons, and that we were being trained to be cogs in a wheel designed to manage chronic disease. So I saw right through it, and which was really challenging for me as a medical student. I hadn't gone to residency yet, being like, oh my God, what did I get myself into? I don't want to be complicit with this chronic sick care system. I don't want to work within that. And I struggled. But I found a residency program in family medicine that also offered an integrative medicine track. And luckily I got into that program and started to learn about plant medicine and, TCM, traditional Chinese medicine, Ayurveda, a little bit of herbalism. And while that was happening, my parents were back home in Oregon, starting to see patients in cannabis clinic. Now I trained in North Carolina, Charlotte, North Carolina.
But your mom started that first, right?
Yes, she did.
Add into it.
That's a pretty cool parent. By the way, that's pretty cool parents you have. So they just like, how did they, because they were from quote unquote traditional medicine, right?
That's what I was, great question, John. I was going to ask, because I think your mom started, and then she pulled your dad. Was your dad resistant to it first, or?
No. So, my parents are from, I guess we could consider old guard conventional medicine.
Right.
And have been taught, like all of us, that cannabis is a drug of abuse. They had both seen colleagues go to rehab for cannabis use. And my mom had just been randomly contacted and asked to fill in for someone at a cannabis clinic, and she had her reservations. Now she loves telling this. She loves telling the story how she went to Cal and never saw cannabis. She loves saying that, and we're like, "You're bugging," because
you went to
cannabis was all over Cal's campus. Like, we don't believe you.
I don't know what that Smell this. I'm not sure. Is that somebody, is that the new patchouli or something that?
Right.
Right? We're like, okay, mom. But she swears that she never saw it. She came from a very religious Pentecostal family. So I could have played into it. At any rate, so she had her reservations, and she called my brother, who had already been, who went to Cal and had never come home, and became an attorney, and actually was counsel to many cannabis companies in California at the time, to medical cannabis companies. It has tax law.
Right.
And she was like, Zach, you can't believe it. I was asked to fill in at this clinic. Like, what do you think? I don't know. And my brother was like, cannabis is legal for medical use in Oregon. It's been that way in California for a long time. Like, it's legitimate. You're going to be surprised. Just try it. Go and see what happens. And she was just knocked off her socks, because regular people were coming into this clinic looking for improved quality of life, wanting to get off their prescription drugs, suffering from chronic and many like compound medical conditions. And she witnessed, she listened, but she also participated, right, in helping them at that point. When they felt that they had failed or had been failed by conventional medicine. That was a real turning point for her. Right. And yeah, she got my dad into it. No resistance there. I mean, my dad introduced her to cannabis.
There you go. Nobody heard that, Rachel. Don't worry.
No resistance there. Yeah, and Jess and I were in the thick of our residency, and they would share their stories with us, and of course I would go back to my attendings and be like, what do y'all think? What do you think about cannabis as medicine? And I got the same old from them, like, it's not a medicine, there's no research, because they didn't know any better, and they're in North Carolina, they weren't getting exposed to legalization the way doctors were out in Oregon. So I didn't push back. I just took note, and but I knew then that I wasn't going to pursue a career in the conventional system. I was going to come home, and the rest is history, suppose.
Join the family business.